Welcome Cardiology Update viewers and listeners. My name is Chadi Alraies. I'm interventional cardiologist at Detroit Medical Center. In this episode, we're going to talk about a recent study looking at the importance or the impact of residual inflammation or LDL value in patient outcome of cardiovascular outcome. The title of the article that published in Lancet is The Impact of Residual Inflammation and Cholesterol in Patient on Statin Therapy. This is a compile 3 trials together that put together prominent, reduce it, as well as a strength trial that looked at the impact of inflammation as well as statin therapy in patient outcome, mortality, and cardiovascular MACE or adverse events. It's a very interesting trial. I just want to give you a little bit of background. As we know, as we are evaluating the risk of heart disease, usually a patient comes to the hospital or the clinic. We evaluate the risk for high cholesterol, family history, and oftentimes we check CRP, or high sensitivity CRP, which is an inflammatory marker that can be up or down or normal. In patients who have, in previous studies, patients who have elevated high CRP has been shown to have association with higher adverse cardiac events. Therefore, a lot of studies done before, the impact of statin and inflammatory markers before, but in this unique analysis that compiled this large studies that has more than 30,000 patients into what is the impact of residual inflammation and LDL level in patients who are already on statin therapy. So again, to understand it properly, patient already on statin therapy, they have inflammation to start with, as well as elevated LDL, and they've been prescribed statin therapy, and eventually we measure their high sensitivity CRP as well as LDL, and to see what is the impact, what is the one that factor that drive cardiac outcome, adverse cardiac events, as well as mortality. Is it the inflammation itself, or the LDL, or both? The findings are really striking. At the end of the analysis, and the investigator concluded that in terms of all-cause mortality, cardiovascular outcome, and MACE, were higher in patients with residual inflammation compared to patients who have residual elevated LDL. This does not negate the fact that LDL is not important anymore. Absolutely, it's really important. But also, oftentimes, when we treat this patient with statin, we assume as long as the patient reaching their target LDL, and depending on the guideline you look at, less than 100, less than 70 in diabetics, but we don't look at the inflammation or how much residual inflammation left in this patient. I think what this study or analysis highlight is the fact that inflammation is important. We have to check CRP in these patients, especially with high-risk features, and drive their therapy and maximize medical therapy based on the residual inflammation, as well as targeting LDL goals depending on the comorbidities the patient has. So I think this is a very interesting analysis, definitely add to what we know before, but definitely highlight the fact that inflammation is continued to be an important parameter in developing atherosclerosis, as well as driving outcome in patients who have high-risk feature for atherosclerosis already on statin therapy. I hope you enjoyed this episode of Cardiology Update. Please watch this episode and others on our YouTube channel and our social media outlet. I am Chadi Alraies from Detroit Medical Center.